Silver Linings Playbook is a movie about two people who fall into an unlikely love brought together by their mental struggles. The male protagonist, Pat Solitano, was in a psychiatric hospital for 8 months following him finding his wife cheating on him and him violently attacking the man she was with. Pat is diagnosed with bipolar disorder and is taken out of the hospital a bit early by his mother despite warnings not to from the doctor. According to Gran et al., broadly, bipolar disorder is a recurrent chronic disorder characterized by fluctuations in mood state and energy. More specifically, a person with bipolar disorder has episodes of mania, hypomania, and alternating episodes of depression. Without manic or hypomanic episodes, the disorder would be major depressive disorder. According to Kayseris et al., both bipolar I disorder and bipolar II disorder are characterized by reward hypersensitivity that can lead to a higher presence of hypomania or mania and extreme mood changes. In bipolar I disorder, a person will go from major depressive to manic episodes. The DSM-5 criteria for a manic episode consists of many different factors. There must be a distinct period of abnormally and persistently elevated, expansive, or irritable mood with increased goal-directed activity for at least 1 week and be present most of the day, almost every day. In Silver Linings Playbook, Pat has an obsession with getting his ex-wife back. He is focused on running every day with a sweatsuit and garbage bag on in order to lose body fat. In addition, he is focused on catching up on the literature that his wife teaches at a local high school and will stay up all night reading books. Also writes letters to his ex-wife weekly that he has his future lover delivered to her in order to prove his love and lack of a mental disorder. In order to qualify as a manic episode, 3 or more of 7 different symptoms must be present. These symptoms include an inflated sense of self-esteem, decreased need for sleep, being more talkative than usual, racing thoughts that lead to a very subjective experience and many different ideas, distractibility, increasing goal-oriented activity, and involvement in activities that have a high potential for painful consequences. In the movie, Pat expresses at least 6 of these 7 symptoms. He is constantly distracted by his goal of getting back together with his ex-wife, despite a restraining order against him, and will be focused on doing certain activities instead of what his parents wish for him to do in order to help them out. Also has an inflated self-esteem when explaining why he is good for his ex-wife, and demonstrates a lack of realistic perception because he thinks he is mentally stable. In addition, extreme talkativeness is demonstrated in a scene where he disturbs his parents very early in the morning to talk to them about the ending of a book he had just finished. This is both a socially unacceptable action and demonstrates an unusual talkativeness that is disruptive to himself and the lives of his parents. Another sign of a manic episode is the disturbance taking a toll on normal social functioning and the episode potentially hospitalizing the person. The disturbances cannot be attributed to a certain substance if it is a manic episode. In the movie, Pat demonstrated the symptoms of bipolar I disorder. In a study done by Baldessarini et al., it was demonstrated that bipolar I disorder started showing symptoms, mainly manic episodes, at an earlier age than the age that bipolar II disorder symptoms were demonstrated. The main onset for bipolar I disorder in this study was around 20 to 25 years old, with the average age of onset being 24.3 years old, while the main onset for bipolar II disorder ranged from 20 to 35 years old, with the average age of onset being 30.1 years old. According to a study done by Almeida and Fenner, the ratio of women to men who have a mood disorder is 3 to 2. However, according to the National Alliance of Mental Illness and along with other studies, there is an equal ratio of those with bipolar disorder between men and women. In addition, this organization says that 2.9% of the U.S. population is affected by bipolar disorder at some point in their life, and 83% of those cases are classified as severe cases. It is found in all ages, races, ethnic groups, and social classes. On average, people with bipolar I disorder will start demonstrating symptoms in their late teens, while those with bipolar II disorder will start demonstrating symptoms in their early 20s. However, symptoms can start at any age depending on the person, although it is rare to develop symptoms after the age of 40. The length of bipolar episodes depends on the person. It can last a few weeks to a few months at a time. However, bipolar disorder is a lifelong illness and episodes can come back over time depending on treatment. In Silver Linings Playbook, Pat had been in a psychiatric hospital for 8 months and had symptoms when returning home due to certain triggers. While doctors do not completely understand the causes of bipolar disorder, there have been a few biological and genetic discoveries leading to what may cause it. Abnormal functioning in brain circuits and chemicals could cause bipolar disorder. When the circuits that regulate dopamine, which affects pleasure and emotional reward factors, are disrupted, it can lead to psychosis with illogical thoughts and behaviors. In addition, the abnormal functioning of the serotonin circuits in the brain can contribute to causing bipolar disorder because serotonin affects many bodily functions such as sleep, consciousness, eating, sexual activity, learning, impulsivity, and memory. When these circuits are disrupted, mood disorders can result. According to Barnett and Smoller, twin studies have proven that there is a link in genetics and bipolar disorder. It was demonstrated that if one twin had bipolar disorder, the chance that the other twin has it is 38.5 to 43%. In addition, people whose relatives have bipolar disorder or other mental disorders are more likely to have bipolar disorder. People who have daily environmental stressors are more likely to have bipolar disorder. In childhood, if a person is living with the parent who has a tendency to have mood swings, substance abuse, financial or sexual indiscretions, and hospitalizations, they are more susceptible to develop bipolar disorder. Stressful life events, whether positive or negative, can serve as triggers to manic or depressive episodes. In the movie, Pat's father is a stressor for his bipolar disorder. Pat's father, Pat Sr., struggles with obsessive-compulsive disorder. His father most likely made Pat stress out as a child, which could have contributed to developing bipolar disorder. Different environmental stressors can also be triggers for bipolar episodes. As an adult, living with Pat's father could have caused him to have outbursts because of the stress that comes from his superstitious compulsions. Additionally, Pat was initially triggered by the external factor of finding his wife with another man and subsequently beating the man almost to death in a manic episode. The manic and depressive episodes associated with bipolar disorder can have major long and short-term effects on a person's body. It can lead to a decreased amount of energy, the inability to concentrate, changes in eating and sleeping habits, agitation, and suicidal thoughts or attempts. Other physical ailments that can come from bipolar disorder are thyroid disease, migraines, heart disease, chronic pain, diabetes, and obesity. In Silver Linings Playbook, Pat deals with migraines on occasion. In addition, he sometimes lacks the ability to concentrate, can get very agitated at small things, and does not sleep as much as he should. A study done by Johnson et al., it was demonstrated that individuals with a better social support system are more likely to recover faster from episodes and less likely to have depression episodes over time. Therefore, those who have more positive social influences are more likely to not have mood or depressive episodes associated with bipolar disorder. Because bipolar is a lifelong disorder, lifelong maintenance is required. Different kinds of medication is essential to stabilize moods. In addition, different psychotherapies can be applied to help with mood stabilization. In a study done by Simhandel, Koenig, and Amon, the relapse rate of bipolar episodes in patients in a 4-year time period was 68%. Therefore, there's a high chance of relapse in the majority of those with bipolar disorder. The changing or stopping of medication leads to a higher risk of relapse. Suicide attempt rates are also high in people with bipolar disorder, being from 12 to 48% throughout a person's lifetime. Lithium has been a long-standing basic medication for bipolar disorder, according to Miria et al. Lithium is a mood-stabilizing drug, meaning it will typically prevent and treat manic episodes. While it is a good mood-stabilizing drug, Barlow and Duran illustrate that it also has negative side effects, such as its toxicity and lower thyroid functioning in higher doses. It can also lead to weight gain and lower energy. Also, according to Barlow and Durand, lithium has at least a 50% success rate in reducing manic symptoms. For the patients who do not respond well to lithium, there are other anti-manic drugs people can take, such as carbamazepine and valproate. As of recent, valproate has passed lithium in prescriptions as a mood stabilizer and is just as effective, but is less effective in the prevention of suicide. Keeping up with these drugs will help prevent manic relapses. Outlined by Barlow and Durand, one bigger issue with taking lithium is that patients do not want to get rid of the manic episodes as much because of the euphoric state, so they will stop taking their medicine in order to get that feeling. In the movie, Pat says he does not want to continue taking his medication because it makes him feel groggy.
What meds are you on?
Me? None. I used to be on lithium and Seroquel and Abilify, but I don't take them anymore, no. They make me foggy, and they also make me bloated.
Yeah, I was on Xanax and Effexor, but I agree, I wasn't as sharp, so I stopped.
You ever take Klonopin?
Klonopin, yeah.
Right?
Jesus.
Like, is it what?
Yeah.
What day is it? How about Trazodone?
Trazodone?
Well, it flattens you out. I mean, you are done. It takes the light right out of your eye.
I bet it does.
There have been a few psychological treatments for bipolar disorder, but it is important to take medication along with these treatments. One treatment recently developed is called interpersonal and social rhythm therapy, in which the patient's circadian rhythm is monitored by monitoring food intake, sleep cycles, and other daily activities, and eventually learn how to deal with stressful life events. Patients have to learn coping strategies to deal with different stressful events and situations. In Silver Linings Playbook, Pat's therapist helps him develop a coping strategy to his and his ex-wife's wedding song. When he goes in for his first therapy session, the therapist plays it and Pat has a violent and aggressive outburst in the office. Over time, the therapist would help him come up with calming thoughts and strategies so he does not have outbursts whenever he hears the song. A big trigger for bipolar episodes is family tension. Therefore, it would be helpful for patients' families to understand the symptoms and triggers for the disorder and help their family develop coping strategies for different stressors. Patients who participated in family therapy along with medication had a significant less amount of relapse compared to other patients. In Silver Linings Playbook, Pat can be provoked by his father. His father makes him stressed out due to his superstitions, and Pat feels pressured to help him. He and his dad had a few violent outbursts instead of trying to calm the situation down using different coping strategies. Compared to individualized psychotherapy, it was also found that family therapy proved to be more effective. Therefore, mood-stabilizing drugs such as lithium or valproate, along with family-based therapy, is the most effective way to treat bipolar disorder. In the future, it may be helpful to increase education on mood disorders to society as a whole. If these issues and different ways to cope with them were taught in elementary or middle school, people would be more equipped to help themselves and each other when dealing with mental disorders such as bipolar disorder.